Saran wrap over cut out pieces of yarn that fit perfectly around the mold, and I'm just going to dip it into the glue. I'm just going to put it around the mold. So I've layered it with a few layers of yarn. Go ahead and mount the teeth into the mold. Put all the teeth in. Let it dry for over 24 hours, and it's fully hardened now. I wanted to use a material that was pretty common and really easily accessible, fairly inexpensive, and pretty easy to work with. Being my first time, I had no expectation of what would happen um, before the 24 hours of curing was done. It was still flexible, and I wasn't sure if it would fully harden and fully set. Overall, it was a success. So I've had my denture in for 24 hours now, and I'm about ready to take it off. In terms of problems that I've had with wearing this denture for the past 24 hours, eating, the first thing that really bugged me was eating. Eating like soft foods like hard-boiled eggs, noodles, and soup, stuff food would get stuck inside. And it was very uncomfortable. And by the end of the day, I can still taste pieces of food coming out from crevices in my denture. Not very comfortable at all. Um, Talking is another big thing that was affected, and um, because my dentures are a little on the thick side, it's hard to talk, and I can definitely feel it. I mean, when I'm not talking, I can get used to it, but once I start talking, when I try whistling, I feel like I want to gag. So it's definitely not very comfortable. In terms of watching the kiss in a denture video, um, I saw how many measurements had to be taken of the patient and seeing how many steps. And although it was done in 24 hours, which is impressive because I know it takes several days or weeks to make a complete denture normally, um, I feel like just like how patients now can get a crown done in half an hour to an hour in-house in a dental office, I feel like dentures, we should develop technology and develop a way to have dentures created in such a timely fashion as well. Um, I think with the technology we have, scanning, we can totally 3D print a denture in the near future. In in addition, I also feel like having denture materials besides just this hard plastic that's fixed. I'm thinking maybe there could be a material that can conform to the mouth and shrink when there's condensation or when there's moisture, such as saliva, shrink to adhere to the roof of the mouth or to the bottom of the floor of your mouth. So you have a tight fit, so dentures are comfortable, thin material, and less invasive. So having worn denture for more than 24 hours, I can definitely empathize with patients with dentures just because it's very uncomfortable, it's very hard to eat. You have to take it out every day to clean it, and it's a whole lot of maintenance. So I feel like um, it definitely has put a new perspective on wearing dentures for me. I thought it was always just, I thought it would be just a snap-on fit, very comfortable and easy um, to wear dentures, but no, this is not the case at all. It definitely take getting used to. I mean, I've only worn it for 24 hours, so compared to patients who's worn it for maybe months or years, but it definitely does affect my social ability. Going out, I'm a little bit more self-conscious when I talk to people. When it comes to eating, I definitely eat slower. I think if you want to go on a diet, wearing dentures is the best way to go because there are some foods that I just do not want to touch and risk while wearing my denture.
So there are many different types of dentures out there. There are immediate dentures, and these are complete or partial dentures that are made before the patient's teeth have been extracted, and they have the denture right after their teeth have been extracted. Delayed dentures are complete or partial dentures which are made after the teeth have been removed and several months have passed and the tissues are allowed to heal and they get their set of dentures. Replacement dentures are dentures that over time, because due to bone shrinkage, a new denture needs to be made for a better fit for the patient. Interim dentures are temporary, immediate dentures while the delayed denture is being made. After a patient's teeth have been extracted, they can put this temporary interim denture on, which is normally held by denture glue because it is not a good fit for the patient in the mouth. So it's for immediate aesthetics and for the patient's ability to chew. Attachment overdentures are dentures that are retained with implant supports. And bar overdentures are dentures that are held by multiple implants which are connected by a bar, metal bars in the patient's mouth. And both attachment and bar overdentures and hybrid dentures, which I'm going to talk about next, are a lot more expensive than your normal, conventional, immediate, and delayed dentures because you have the added on cost of having implants. And implants are a lot more in terms of price, and also they're a lot more invasive because there is a failure rate in implants. So in hybrid dentures, um, there are multiple separate implants in the patient's mouth that the denture is permanently attached to. So it's a hybrid between a fixed prosthodontic and implants. So the theory of idealism in dentures and making dentures is it's a conglomerate of ideas that inform clinicians where teeth go in order to optimize aesthetics, speech, and function. This theory of idealism is what we keep in mind when we make dentures. Underneath the theory of idealism, we have meta-idealism, macro-idealism, meso-idealism, and micro-idealism. To attain ideal dentures, we follow these dress to the nines guidelines. The first step in obtaining meso-ideal dentures is to have the patient turn to the side with their mouth at rest to obtain the buccal lingual position of the maxillary central incisors. In the second step, we view the patient on from the front with their mouth continued to be at rest, and at this position, we can determine the incisal length of the maxillary central incisors, as can be seen in these examples of Heidi Klum. For the third step, we have the patient turn again to their side with a smile. Therefore, now we can determine the maxillary occlusal plane angle. Fourth, we have them face us front view with smile, and then we can determine the buccal corridors. Fifth step, have them keep the same position and smile, determine the maxillary midline position. Next step, determine the maxillary midline angle, and then the zenith line. For the eighth step, you have them turn to the side again with their mouth at rest so that we can determine the buccal lingual position of the mandibular central incisors. And then for the final step, we have them turn back to the front with a smile, and there we can determine the incisal length of the mandibular central incisors. Now below you can see we have the micro ideal guidelines. We're not going to worry too much about this because in the future, the dental labs will be the ones taking care of these micro ideal conditions. So here are the steps to fabricate a denture. First, we make a preliminary impression using a stock tray specifically designed for edentulous patients and alginate. We then fabricate the preliminary cast and custom impression tray. We want this cast to be slightly overextended into the periphery so that we can make sure to capture the vestibule. A master impression using border modeled custom tray is then made with either PVS or polyether. We then send the impressions to lab for fabrication of a master cast and record the base wax rim. When we get the impression back, we confirm the fit and extension of the record base. Contour the wax rims for lip support, feature incisal edge position, occlusal plane, occlusal vertical dimension, and the midline. We also can record the facebow transfer and bite registration at the correct vertical dimension. At this step, we also can select the tooth mold, tooth shade, and desired occlusal scheme. We return all these items back to the laboratory, and the lab will index and mount the cast to develop the trial denture setup. When we get the trial denture setup back, we try them in, and depending on the clinician and technician preference, this may either be an aesthetic try-in of just the maxillary anterior teeth or the full setup. We then evaluate for accuracy of mounting, the occlusal vertical dimension, aesthetics, and phonetics, and we perform modifications if necessary. We then return all the items back to the lab for the prosthesis fabrication. Dentures should be remounted and equilibrated to compensate for errors in denture processing. The dentures should be return finished and all external surfaces polished. Many clinicians will request clinical remount casts to be fabricated and returned with the case. Finally, we insert the dentures and adjust as necessary. Typical post-insertion follow-up includes 24-hour, 1 week, and 1 month appointments. We determine an appropriate recall interval for the patient to come back. So we had the opportunity to work with a live patient. This was my first edentulous patient. At this point, we were already past the point of the preliminary impression. My preliminary impression turned out really well, and it was selected to be used as the master impression. Here, I'm taking the master impression of our patient, and this is the result of it. So at this point, we've already created the wax rims, and now we are trying them into the patient, and we're having them put it on and we're going through the dress to the 9 procedures as I've discussed previously in this video, and we are taking all the measurements so that we can get ready to set the teeth and make the initial dentures. So here in this photo, there's the photo of all the teeth that we set, my classmates and I set for our patients, and there are 2 sets. There's one set that is non-ideal, and there's one set that is ideal. And the 2 videos that will follow will show first the ideal denture, which is supposed to fit, and the second video will show the non-ideal denture, which is the posterior teeth are way too buccal.
So midline's off and the crossbite on the left.
Yeah, and the right I can see a little bit.
And a little bit on the right too.
Okay, and these are your non-ideals or your
These
ideals?
are the ideals.
Okay.
They're off.
Perfect.
Cool. Thank you.
So these are the non-ideal.
Non-ideal posterior are way too buccal.
Okay.
Yeah, I bite my cheeks.
Oh yeah. So her cheeks are way puffed up.
Uh-huh.
Yeah.
Yeah.
Good?
Yeah.
Fills me up. Voluptuous.
Cool. All right.
So here in this photo, you can see that both the patients that we had, the edentulous patients that we had, were trying on dentures and examining them and giving each other feedback on which one they prefer and which one they didn't. And we're all kind of onlooking and just appreciating this awesome experience to be able to see our live patients try on dentures that we made for them.
So now we've come to the end of my Prosfolio video. In conclusion, I would have to say it has been a great experience learning in the lab techniques of how to create ideal dentures, not only based on science, but also based on the dress to the 9 guidelines that we had. Going into the lab in the clinic, going from the lab to the clinic, being able to interact with a patient, just observing my classmates, I was able to see that everyone was extremely professional, extremely appreciative at the end of the event, end of the experience. Just the fact that we got to help these patients, we got to experience them, we got to see the raw emotion of them putting on and trying on the dentures, whether it be the non-ideal, and everyone got a good laugh from, the non-ideal dentures, the ones that had, caused problems, and the ones that were ideal. It was hard to get perfect ideal dentures personally for myself, but it was a great experience because, I could really see that the interaction between the patient really matters, because I was very genuine and I was gentle and I was always remembered to have a smile on my face. I felt that the patients really reciprocated that, and even though dentures did not fit quite right, they still had a great attitude because I had a great attitude going forward and interacting with them. So that's all for my Prosfolio. I hope you enjoyed it. Thanks.